So one of the most common things that people complain about is a sore back and a sore neck or some kind of musculoskeletal injury, and it really holds you up. So it holds you up for work and it holds you up for play. So when you have an injury like that or a complaint like that, there's two elements that come into play. You've got biomechanics and biochemistry. So biomechanics is all about where structure governs function. If things are in the right place, they work better, and you've got to make sure that that's happening if you want to work better. Biochemistry, on the other hand, is all about the nutrients, if you like, that you need to make sure things are working properly or are healing effectively. Like, for instance, if you had something that was out of alignment and it was damaged, and then you had a treatment and that lined it all up, well, what you've done is now put something damaged into a better position, but it's still damaged. You haven't repaired it. So the concept of looking at both these things is really, really important. And for me as a practitioner, and I've got a bit of background in both of these things. So a lot of naturopaths don't work in biomechanics, but I do. And it's worth checking that out if you want to see a naturopathic practitioner. Find out whether they've got a bit of both happening, because it is pretty helpful to know that. But so in the context of biomechanics, making sure joints are moving and muscles are soft and not too hard, and the range of motion is where it needs to be. Really, really important. With regard to biochemistry, if you're low in nutrients like zinc or magnesium, you're not going to heal or relax. You may have inflammation that you need to be addressing, and you can do that with really simple things other than using a drug. And that getting rid of that swelling can really help things get better, because you can very quickly start to move the way you're supposed to move rather than moving with restriction. And all of that helps you feel better.
So if I want to find out about biomechanics, and biochemistry, who do I see?
Yeah, well, look, I mean, if you want to find out about biomechanics, you're really going to see someone like a physio or a chiro or an osteo or a naturopath like me who has a bit of that training. And, in that sense, you're going to have a treatment that is going to be body work. You're going to be touched and pulled and stretched and whatever, but hopefully you're going to start not feeling okay to feeling okay, not moving okay to moving okay. There's going to be this change in how you're going in a favourable way. But again, if you do that and you say, well, look, I'm a bit better, but I'm not 100%, start remembering there's this other thing called biochemistry, and you might need to look into that. And when it comes to biochemistry, a doctor is going to give you some help there. Some of the drugs they use obviously work on that. It's seldom you see a doctor that's going to lay on the table and line you up and whatever, but they'll certainly give you a script to relax a muscle or to give you some pain relief. A nutritionist obviously can help you there. They understand how the biochemistry works. And again, I'm plugging my own, but that's what naturopaths do. We're really into understanding the needs, the nutritional needs particularly of the body. So, you do that, and biochemistry and biomechanics, and I think your neck pain and your back pain and that injury that seems to be lingering, you're going to get it sorted.